The WHO confirmed that the novel coronavirus was the cause of the respiratory illness to a cluster of people in Wuhan City, China. The first human case of COVID-19 were first reported by the officials in Wuhan City in December 2019. The COVID-19 pandemic has led to a dramatic loss of human life worldwide. This has caused an unprecedented challenge to public health, food safety, and the economy of the countries affected. Millions of people are dying. The United States, Brazil, and India remains the highest in the death toll of COVID-19. The COVID-19 pandemic has spiked throughout the world, more specifically in India, Canada, Brazil, and USA. The number of cases of COVID-19 in the United States continues to grow and decline. As vaccine eligibility rises, the nation's number of cases fall. Brazil has the highest number of daily deaths. This has put the country as the epicenter of the global COVID-19 pandemic. Canada is considered a high-risk country due to its high number of cases. Most of these cases have been in Ontario and Alberta. India was drastically affected by the COVID-19 pandemic. Today, the country is experiencing a massive growth of number of COVID-19 cases. And how do these societies promote the mitigation of COVID-19?
COVID-19 pandemic is an unprecedented crisis that drastically affected India and countries across the globe. India's Ministry of Health and Family Welfare issued travel advisory restrictions, self-quarantine rules, social distancing, personal protection measures, and widening the testing and treatment capacity to cope with the pandemic. But India today is experiencing an exponential growth in the number of COVID-19 cases and the deadly second wave spread. Thus, implementation of measures to mitigate COVID-19 pandemic in India should include focus on moderate but sustainable physical distancing, such as prevention of mass gatherings, religious festival gatherings, political events, and cultural celebrations should be restricted. Also, strengthen the public health response by expanding and maximizing health service capacity by bringing in the leveraging home-based care and mobilizing international support, where Government of India should be focusing its efforts on coordinating in an international humanitarian response to improve health system capacity through expanding cooperation with national government, accepting international cooperation and support, and utilizing India's access to IMF and World Bank funds.
The numbers were already concerning in March 2020 when Brazil reported less than 300 COVID-19 deaths and roughly 6,000 cases in total. The daily average now exceeds 2,000 deaths and over 70,000 new infections. Brazil is dealing with an out-of-control epidemic, with health systems in the majority of Brazilian states on the verge of collapsing or already in ruins. Nonetheless, even in the face of such a severe circumstance, Brazil believes that there are solutions to lessen the human lives lost during the pandemic are as follows. In the absence of larger scale tests, health authorities can improve testing processes by using quick antigen tests. Brazil immediately take collective efforts to curb people movement while ensuring that vulnerable populations have the fundamental necessities of life in exchange for their economic activity being disrupted. That is why now more than ever, it is critical to unite behind essential actions in order to prevent an even higher increase in the number of cases and deaths that could occur.
As of May 17, 2021, a total of 1,334,104 confirmed cases caused by the COVID-19 and 24,983 deaths were reported in Canada. Many Canadians succumbed to the disease in recent months as the third COVID-19 wave overwhelmed hospitals, especially in Ontario, Alberta, and British Columbia.
Canada responds to COVID-19. They support provinces and territories in responding to COVID-19 such as with contact tracing, testing assistance, testing equipment, laboratory services, outbreak management, and voluntary safe isolation sites. They also develop apps and tools including the free COVID Alert app, which notifies you if someone you were near in the past 14 days tested positive. The Canadian Armed Forces and the Department of National Defense are working with civil authorities at all levels of government. The support includes, first, sending medical staff to support long-term care facilities. Second, deploying Canadian Rangers to deliver food, supplies, and assistance to northern communities. They created a program to help Canadians without financial means and whose plans to return to Canada before the COVID-19 were interrupted. This emergency repayable loan can cover the cost to return home or short-term needs while they make efforts to return to Canada.
In today's global interconnected business climate, COVID-19 is affecting the way Canadian companies operate. Efforts to control and mitigate the spread of the virus include temporary restrictions at travels and at borders. These efforts could have further implications to the international business development activities.
According to Johns Hopkins University and Worldometer, the United States has reported more than 33.7 million confirmed cases and 600,174 people died from the disease, with 27,136,425 cases who recovered, which remains to 5,981,072 active cases as of the 16th of May 2021.
COVID-19 vaccines are being distributed across USA and its territories. 3 vaccines, Pfizer-BioNTech, Moderna, and Johnson & Johnson, have been authorized for emergency use and are part of the widespread distribution process.
The table shows the number of people from USA who received their COVID-19 vaccination, those who had their first vaccine dose, and people who are fully vaccinated.
The government of the United States of America offered various types of assistance to people and businesses who were affected by the outbreak brought by the COVID-19 pandemic, such as small business loans and assistance, unemployment benefits, financial assistance for food, housing, students' loans and bills, health informations, COVID-19 testings, and vaccinations.
The United States of America prioritized the at-risk population to be vaccinated first, which includes the medical staff, people from long-term facilities and nursing homes, the elderly, people with medical conditions, and essential workers.
Protecting the public's health is paramount. The mitigation strategies to consider by the global society as to prevent the strike of COVID-19 cases in USA are as follows.
Promote behaviors that prevent the spread of virus, such as educating oneself with etiquettes, maintaining a healthy environment, maintain healthy operations such as observing social distancing, and limit group size as much as possible. Be aware and be prepared when someone is sick or infected by the virus. Ultimately, taking the courage to receive doses of vaccinations for oneself and people around us.
The global society is encouraged to act, be a part of the solution, and be the solution.
In the 21st century, the COVID-19 outbreak has become the most crucial global public health emergency. to human society. Various mitigation strategies have been taken to slow down the rapid spread of COVID-19. These mitigations can only start with us. If we want to have great change to our situation, let us start with ourselves, because change starts with me.
Change
With
Me.